It goes without saying that providing high-quality care for patients is a top priority for all provider organizations. But they also need to keep the business running if they're going to achieve that mission. Most provider organizations make the majority of their money through reimbursements from payers for the services that they provide to patients. But the size of reimbursements can vary a lot. There are 3 factors that impact the size of any given reimbursement: where the service took place, the type of service provided, and the type of insurance a patient has. Let's start with where the service took place, also known as the site of service. Provider organizations will usually receive more money for inpatient care, meaning an overnight stay is involved, and less money for outpatient care. Providers also receive more money for providing surgical care relative to medical care. As the name suggests, surgical care is anything that involves a surgery or a procedure. Think a hip or a knee replacement. Medical care involves caring for sick patients, often for a chronic condition. Think heart failure or diabetes. And lastly, providers receive more money for care delivered to patients covered by commercial insurance. Think UnitedHealthcare or Blue Cross Blue Shield, and much less for care delivered to patients covered by public insurance programs like Medicare or Medicaid. In fact, on average, private health plans pay providers 241% more than Medicare. And of course, Medicaid pays even less than Medicare. Some of this might seem a bit abstract, so let's look at an example to understand how this works in real life. Meet our 2 consumers, Lisa and Leonard. Lisa is 78 years old and falls down a step when leaving her home for church choir practice. She breaks her hip during the fall and goes to the hospital for surgery, where she stays for 2 days to recover. Luckily, she has insurance to help her cover the expenses. Because she's over the age of 65, she has coverage through Medicare. Leonard is 52 years old. He also breaks his hip, but in a car accident. He goes to the hospital, has surgery, and stays in the hospital for the same length of time. He's a software engineer at a technology company, and he has insurance coverage through his employer to help him cover the cost of his care. Which one of these patients results in more reimbursement for the provider? Both patients have the same injury and receive the same surgical care at a hospital. And these factors alone would lead us to believe that both would be reimbursed equally. However, Lisa is covered by Medicare, while Leonard has employer-sponsored insurance. And we know that payment rates for public insurers tend to be much lower than rates for private payers, even for the exact same care. That means we would expect Leonard's care to lead to larger reimbursement for the provider. But what if Leonard had gone to an outpatient ambulatory surgery center instead of the hospital? We know that outpatient care is reimbursed at a lower rate. So in this scenario, it's a lot more difficult to say which provider would receive more money. Now, despite all these moving pieces, or maybe because of them, all provider organizations aim to have a steady, if not growing, volume of patients. More patients means more revenue, and that's true regardless of the site of care, or the service provided, or even who's paying. That means that all provider organizations are focused on attracting and retaining consumers, which only increases competitive dynamics. And while there are 3 key factors that influence the size of reimbursement, none of these elements are static. They constantly change as policy and market dynamics evolve. There are some trends that we are tracking that will ultimately impact how providers make money. Overall, more care is being delivered in the outpatient setting and ambulatory settings. This is known as the site of care shift. And this is good news for a lot of patients. But it can hurt provider margins because it essentially means a price cut. They will be reimbursed at a lower rate for procedures that move from the inpatient space to an outpatient setting. That trend is being driven by purchasers. But there's another trend that we frankly have less control over. The population in the United States is getting older and it's getting sicker. And as the population ages, more patients are needing medical care to manage chronic conditions instead of that high-margin surgical care. That's known as the case mix shift. A sicker population means more medical care, which means lower reimbursement. But an older population also means a revenue hit. More Americans will be insured through Medicare, which we know, based on our example, offers lower reimbursement than commercial payers. This is called the payer mix shift. At the end of the day, the site of care, case mix, and payer mix shifts will be a huge hit for today's providers. Provider organizations have to keep a pulse on these changing dynamics to understand how they will impact their current and their future revenues.